Computed Axial Tomography, aka CT or CAT scan, can be broken down into computed with computer, tomo to cut, graphy, pictures. This modality uses ionizing radiation that creates cross-sectional images. These images can provide a variety of different information from bone, soft tissue, brain, and heart. CT is mainly used especially during emergencies such as traumas because it provides quick, detailed information that can allow doctors to determine what to do next with the patients. The CT machine consists of three components: the X-ray tube, a gantry, and a computer. The X-ray tube works the same as in conventional radiography by producing X-rays from the rotating anode that was heated by the cathode inside the vacuum tube, which also uses the concept of technical factors such as the amount of exposure time, MA, and KVP. The patient is placed through a gantry tube which is surrounded by electronic detectors located on the opposite side of the X-ray tube. Once the X-ray beam enters and passes through the body, the detectors pick up the attenuation that exits the body. Once the detectors receive the electron beam, it is then converted into electrical pulses that is sent to the computer. Once the information is collected, cross-sectional images of the anatomy is shown in 2D pixel or 3D voxel. There are four generations of CT scanners. The first generation uses a single detector that is pencil-like X-ray beam that scans for 25 to 30 minutes. The second generation has 30 detectors with a fan-shaped X-ray beam that scans for 90 seconds. The third generation has 288 through 700 detectors with a fan-shaped X-ray beam that scans for 5 seconds. The fourth generation has 2000 plus detectors with a fan-shaped X-ray beam that can scan for a few seconds. And today, in the hospital setting, the third and fourth generation is mainly used. CT scans combines variations of X-ray images from different angles in a 360 view and allows doctors to determine different diseases and injuries in different areas of the body. The X-ray tube shoots an electron beam towards and through the patient's body, being collected by electronic detectors, which is then sent to the computer. Once the machine scans the images, it converts them into cross-sectional images, providing 2D and 3D images, allowing the tech to see the anatomy of the patient, such as bones and soft tissue. CT provides a well-detailed study compared to other modalities, but similar to some, such as MRI. The process is painless, however, this system does ionize the body more compared to conventional radiography. When the images reach in the computer, there are different tools that you can use to evaluate the study, such as erasing unnecessary anatomy, creating axial, sagittal, and coronal views of the images, changing the window level of the images, and building studies such as calcium score. In CT, the Hounsfield number is determined by the density, which is water and air, of the body. The standard temperature of the radial density of water equals to 0 Hounsfield units. Air equals to negative 1000 Hounsfield units. Dense bone and metal over 3000 equals approximately to 2000 Hounsfield units. The window level equals to negative 1024 through 3071 Hounsfield units. The advantages of using CT is that it is really quick to use. The information you will receive will be fast. It only takes about 3 to 5 minutes for each procedure. It is really easy to use, and the information you receive from the images are very detailed. The disadvantages of using CT is that it is expensive. The preparation time does take a while, such as preparing the contrast, placing the IV in the patient's arm, getting blood samples for the bone and creatinine levels, The modality does use ionizing radiation, and the patient can have allergic reactions towards the contrast. The clinical applications in the images can show soft tissues, fats, tissue of the lung and liver, tumors, lesions, blood clots, effusions, and metastasis. For radiation protection, the tech must make sure that they use the right protocol using the right technical factors, such as the KVP and MA, which is determined by the patient's body size, age, and weight. The patient must make sure that they are limited with the amount of scans they receive within a short period of time. And for the tech, they must make sure that they are in the control room behind the wall and with the door closed to make sure that they do not receive any scattered radiation. In CT, the sectional anatomy has three views: axial, coronal, and sagittal. In axial, you are looking down through the body. In coronal, you are looking from anterior to posterior of the body. And in sagittal, you are looking from the left side of the body towards the right. In conclusion, CT is an ionizing modality that uses an X-ray tube that shoots electron beams through the body in a 360 view that is received from an electronic detector that is converted into cross-sectional images that can be edited into axial, coronal, and sagittal views. This modality is mainly used in the hospital setting due to the variations of well-defined details and how fast they can provide the information to the doctors. Thank you for watching.